Today we learn another part of diabetes mellitus. What is pre-diabetes? Channel's name is Heartbeat. My name is Dr. Amrit Kejriwal. Pre-diabetes. In pre-diabetes, people have higher than normal blood sugar level, but it is not high enough to be considered as type 2 diabetes mellitus. Many people in the world don't know that they are pre-diabetic, and they're more likely to develop type 2 diabetes. Its advantage is that if you know you're pre-diabetic, it's a stage of preventable diabetes and you can control, then you will not land up in the complications of diabetes. I have put a separate video on complications of diabetes. The various symptoms. Now usually patient of pre-diabetes does not have any signs or symptoms and usually diagnosed on a routine investigation for some other illness. Progression from pre-diabetes to type 2 diabetes, patients have increased thirst, frequent urination, increased hunger, fatigue, blurred vision, slow healing of cuts and wounds, tingling, numbness or pain in hands or feet, patches of dark skin, itching and fungal infections. So we have to see if you're getting any of these symptoms, then remember you might have progressed from pre-diabetes to type 2 diabetes. Various causes. Cause of pre-diabetes is practically unknown, but usually these patients have a family history of diabetes. Again, genetics, regular physical inactivity, overweight, and central obesity. Central obesity means increased fat in the abdomen. There are various risk factors. So if you have increased weight, waist size is more, 40 inches in the males usually. Diet, eating a high calorie diet, inactivity, inadequate sleep, and commonly associated with people having obstructive sleep apnea, tobacco smoking, age, family history, race or ethnicity, gestational diabetes, and polycystic ovarian syndrome. Now remember, these are the modifiable risk factors for pre-diabetes. These are not modifiable. You cannot change your age, you cannot change your family history, you cannot change your race. Gestational diabetes occurs by itself and polycystic ovarian syndrome occurs by itself. So these are the modifiable which you can do, and these are not non-modifiable. So technically if you have family history, then you have to take control of these factors. You cannot control these factors. There are various associations with pre-diabetes: increase in blood pressure, decrease in high density lipoproteins, which is the good cholesterol, and increase in triglycerides. There are various investigations for pre-diabetes, diagnosing pre-diabetes. So if you're a diabetic and you want to see your children are having or not, then you do a fasting blood glucose test. And this technician will take a venous sample, and a normal is less than 100 milligrams per deciliter. Pre-diabetes is between 100 to 125 milligrams per deciliter, and diabetic patients have a blood sugar greater than 126 milligrams per deciliter. So if you do a fasting blood sugar and it's between 100 to 125 milligrams per deciliter, then it's pre-diabetic. Again, another test is oral glucose tolerance test. Do the fasting blood sugar is checked. Drink something sweet, usually 75 grams of glucose. And then 2 hours after that, a second blood sample is tested. The results of the second test are interpreted. Normal is less than 140, so you're not a diabetic at all. If it is between 140 to 199, you're a pre-diabetic. Again, you have to do all the lifestyle modifications, which I've already mentioned. And you're a diabetic if the sugar is greater than 200 milligrams per deciliter or higher. Hemoglobin HbA1c is also considered. Normal is less than 5.6%. Pre-diabetes is 5.7 to 6.4%. And diabetes is greater than 6.5%. I made a separate video on HbA1c. Complications: high blood pressure, high cholesterol, heart disease. So all these complications may be associated with pre-diabetes or going up into diabetes, stroke, kidney disease, nerve damage, vision problems, possibly loss of vision, amputations, and how you can prevent: eat healthy food, exercise 150 minutes of moderate aerobic physical activity week, or about 30 minutes on most days of the week, at least 5 to 6 days, and lose excess weight. So you should maintain your weight physically, and if you've got blood pressure and cholesterol, control that also. So chances of going in from pre-diabetes to diabetes will be less. And don't smoke above all. Thank you for watching the video. Please do not forget to like the video. Feel free to give comments. Please subscribe to the channel and share link with your friends. Thank you once again.